Zobo, the homemade drink also known as hibiscus tea, is said to have many nutritional contents. But amidst the praises sung in the name of Zobo, there are some who are of the opinion that no matter how beneficial the Zobo drink is, it may not be suitable for everyone. Amongst the people who are advised against consuming Zobo drinks are pregnant women and lactating mothers. In the month of November 2023, the claim that Zobo drink causes miscarriages resurfaced, and it was widely shared. Tonight on Top Talk, we're joined by an expert in the field, Dr. DR.ADEBANJO ISAAC, resident doctor, Department of Obstetrics, Gynaecology at the University of Abuja Teaching Hospital. He helps us separate fact from myth. All right, Dr. Banso, it's good to have you. Good evening.
Thank you.
Right.
Good to have you here.
Yeah, it's been a while.
Yes, in 2 years, I think.
Yes, how have you been?
Fine, thank you.
All right, so let's get straight into it. I'm sure you're aware of the claim. The claim is that Zobo drink causes miscarriages in women. So I don't know if you can give us a background before we delve into the direct answer. First of all, the Zobo drink, first of all.
Okay, well, Zobo is usually from the leaves of the flowers of the hibiscus plant. So it's used to make a local drink. Actually, the Zobo drink is one that across all of the continents of the world is used, although it has different names across all continents. However, locally we call it Zobo. Basically, it's the hibiscus leaves that are used to make that drink. Now, there have been claims and reports that this Zobo drink might be responsible for miscarriages, which is the loss of pregnancy before the pregnancy is viable enough or the baby is able to survive outside the womb. Due to some of these claims, some research has been done. Now, this research were done, they're animal studies, they're done using rats. The conclusions of majority of this research showed that they caused preterm labor in some of these rats because they sort of induced the womb or the uterus to begin contracting ahead of time, and so they lost those pregnancies. So those were in animals. And so some of those studies have now been extrapolated to human beings, and then advice have been given out that, okay, people should not take Zobo or hibiscus drink during pregnancy.
So is there any conclusive answer in that case? Because what people want to really hear is it true or not? Is there any way we can conclusively answer the question? Because I believe there have also been talks about the or let me understand, is every research automatically valid, or there are levels to each and every?
Okay. The strength of the research actually varies, and in this particular case, conclusive evidence, you cannot say with finality that those studies that were taken on in animals can be 100% replicated if they were to be done in human beings. You understand? So, and because these studies have not been done on human beings, cannot say for sure that Zobo drink will have the same effects on human beings. You understand? However, you can understand the ethical dilemma in conducting such research on human beings. First of all, who will you recruit for a study that say, okay, we'll give you Zobo and see whether you have a miscarriage? Nobody will sign up. Or people might sign up, but you can understand the challenges in conducting such a research on human beings, and of course the ethical conundrums that might ensue. So we cannot say without a shadow of doubt that Zobo causes miscarriages in human beings. You understand? Zobo, naturally, Zobo is a very healthy drink. You understand? That's most of these drinks that are made up of natural fruits. You understand? So it's normally a healthy drink. In fact, there are some studies that have been done in some parts of Africa about Zobo, or the use of hibiscus leaves, and how it boosts the red blood cell during pregnancy. You know, one of the complications, most common complications of pregnancy is anemia in pregnancy, where the red blood cells are depleted. However, in many studies that have been done with Zobo, we've seen that Zobo was seen to increase the levels of red blood cells in the participants. However, those studies did not look out for the chances of miscarriage. So there are no conclusive studies in human beings that can say that, okay, can have miscarriages due to the fact that drank Zobo.
So does this mean, you know, speaking from a researcher's point of view, this is something that can only be proven if you took actual pregnant or lactating mothers or thereabouts and did the study on them? There's no, I remember back then in school, there sometimes when you are looking for a result, you might not go directly, but you know, this is what's going to lead to this, and then you go after that. So is there any avenue where it is something that could be looked at or conclusively answered without having to ask someone to come and try if their baby will die or not?
Okay.
Or the fetus?
Definitely, the only way that we can tell what Zobo does to human beings is to give Zobo to human beings. You understand? However, as long as studies have not been done on the effects of Zobo on human pregnancies, we cannot say for sure. We can only assume that this is what will happen. And mind you, you know, rats have small body surface area. So which means that the way they metabolize drugs is not the same way that we do.
Sorry to cut in there. I don't know, has it ever happened where studies done on rats thereabouts, you know, were informed decisions for human beings in terms of if there wasn't any human test, so to speak? Has it ever been okay or enough to use what happens with rats to extrapolate? Okay,
yes. In the pharmacological industry, there's people that pharmaceutical companies, the ones that make most of our drugs. In fact, most of these vaccines, medication that we have often start from clinical trials. And the clinical trials, a lot of them initially start from animal trials. You understand? So by the time they give a drug to animals, and then they see the effects, and that the effect is wonderful, the next step is to take it on a limited batch of human beings. Of course, that's the first. Then they will widen the net to include more human beings into the research, and then of course test it in the general population. You understand? So definitely, animal studies are in fact, they are the backbone of clinical research. But like I said earlier, there becomes an ethical dilemma when the research, the result of the research is like a negative, you have a negative conclusion. For example, now, if I'm testing a drug for cancer and it's curing cancer in rats, I may want to test it in human beings because that's a positive end result. But if I'm testing a drug that can cause miscarriages and is causing miscarriages in rats, I will be reluctant to want to take it out on human beings because what I got from the rats was not really encouraging. And of course, nobody wants to lose their pregnancy.
Yeah. But does it ever happen where those studies, what's the word now?
Yes, it does.
Where it worked well for us, but it didn't.
Yes, many studies where trials have been conducted, and then there's some efficacy in rats or even other animals, and then the same effects could not be duplicated by the time there were human studies. And sometimes it may not even necessarily be that they could not get the same effect. It may be completely different effects. For example, now there may be a particular substance might be beneficial to animals, and then when they test it on humans, they'll start seeing other effects like maybe kidney damage, liver damage, understand, which they did not probably see while they were doing the animal studies. Because like I said, there are still differences in the metabolism of substances between animals and human beings.
All right, that's fair enough. Before we delve into this, what we usually, divide these fact checks into is true, mostly true, false, mostly false, or unproven. So if you had to pick a category for this, if someone asked, does Zobo cause miscarriage in humans, would it be true? Would it be mostly true? Would it be false, mostly false, or would it be unproven?
It's definitely to be unproven. You understand? As long as there are no human research, is unproven. You understand? So as it is now, it's just suspicion at best. It's just a suspicion that it might cause miscarriages, because there are lots of pregnant women that take Zobo without any deleterious effects. And interestingly, in the social media, there's a lot of funny stuff about Zobo, and some people talking about using Zobo as a form of contraception. That's a way of even preventing pregnancy. That's a very, very dangerous thing, because anyone that decides to take Zobo as contraception can as well decide to start antenatal.
Family plan. Well, I think that's some of the things we try to let people know. Interestingly, I've seen comments where people say, if is when you try to use it, that it will not work. Because even birth control methods, I think I've seen, maybe you can help me also clarify this. I've seen certain social media posts where a child is born with something on the head, and they say this was the birth control method the mom was using, and somehow it still happened, and so on. I wonder if there's any veracity to those claims, because people say if they actually try to use Zobo to cause miscarriage, suddenly it won't work because maybe some sort of placebo effect. I don't know if that's how it works.
Okay, well, I think there are two parts of your question. The first one is because if they intentionally try to cause miscarriages with Zobo, like to know, first of all, even unintentionally, it has not been proven that Zobo causes miscarriages. So whether, since it has not been proven, it might be something else. For example, now, if let's say I ate rice in the morning, and then I was going on the road and I kicked my leg on a stone. The fact that I ate rice doesn't mean that it was the rice that made me hit my leg on the stone. You understand? So it's possible that that stone was somewhere that it wasn't before, and nobody's expecting the stone to be there, and I'll kick it. Then somebody else that ate rice in the morning can now kick their leg against the same stone. I get what I'm saying. And so if two of us now meet, and I say, what did you eat this morning? You say rice. I say, I ate rice too, and I hit my leg on stone. You say you hit your leg on stone. It's possible for two of us to now come to the conclusion that it's the rice that caused us to hit our legs on the stone. Now, why did I say that? Truly, some people that might have taken Zobo might have had miscarriages. But what it means for it not to be proven that it's Zobo that is responsible for the miscarriage is that it's possible that something else that actually caused the miscarriage in those women and not the Zobo. It might even be something else that they used to even prepare the Zobo that caused the miscarriage. You know, Zobo, a lot of people put other different leaves. They put a lot of cloves, add a lot of ginger, garlic. Some people different herbs entirely. Some Zobos are, in fact, for lack of a better word, they become concussions. You understand? People mix a lot of things and then add it to Zobo. Of course, they still call it Zobo because it's red and it's based off of the hibiscus tree. Then on the second part of the question, contraception normally, while it's widely effective, it's not 100% effective. You understand? The only method of contraception that is 100% effective is abstinence. So as long as you're using a man-made method of contraception, they have efficacy rates. You understand? So, and most of them, with good use, the efficacy rate is as high as 98 to 100%. You understand? But if there's 98 to 100%, it also means that there is that maybe 2 to 0.1% that may fail. You understand? So there is possible for a family planning method to fail. But it doesn't mean that family planning does not work. It's just that for some reasons, and then for people that have intrauterine contraceptive devices, some of them, in fact, all of them have expiry dates. Okay. You understand? So there are some that last for 5 years, there are some that last for 10 years. So if you used it beyond the period of its efficacy, let's say it's supposed to be for 5 years, and you have it, and it's more than 5 years, so you don't expect it to still be functional. You can have it and get pregnant. You understand what I'm saying?
Right. So while we're here, I believe we've successfully, solved that issue on that claim, unproven. That is the verdict here. So if we can just do a quick, enlightenment on, pregnancy and how, or things to avoid, because there are a lot of I don't want to call them laymen out there, but there are a lot of people who are always ready to dole out advice. And I don't mean to attack any category, but the average Nigerian mom, seems to think that she's a doctor in her own right, so we hear a lot of advice left, right, center. So as a professional, I'd like to get your thoughts as to, are there really things that pregnant women should avoid and should also, try and do more of or eat more of if it's food? Because I take, for instance, the issue of exercise. Some persons say that it can cause damage. Pregnant woman should, take herself calmly. And we have on the far side, others are saying there's nothing wrong. It makes your, your pelvic walls even ready to push and so on and so forth. So if you can help us with some of these conceptions and misconceptions.
All right. So pregnancy, of course, is a thing of joy, and then usually something that is usually desired by a lot of families. And so by the time it comes, people are trying to protect pregnancy at all costs, which makes them do a lot of things that some might tag as funny. So strictly, the major things that should be avoided during pregnancy are alcohol, and then of course substance abuse, cocaine, tramadol. So anyone that is taking all those substances, they have a chance of causing structural damage to the growing fetus. Understand? So all those ones, they are a no. Then when someone is pregnant, any medication the person that has been on prior to pregnancy need to be reviewed by an obstetrician. You understand? Because there are many drugs that are used for different things. For example, hypertension. There are many drugs that are used for seizure disorders. You understand? Drugs that are used for people that have goiters. You understand? Those drugs have damaging effects to the fetus. Some antibiotics have damaging effects to the fetus. So when it comes to medication, all medication must be scrutinized by an obstetrician. You understand? Some of these drugs may be changed to other types that are safer in pregnancy, for example, antihypertensive drugs. There are some antihypertensive drugs that are safe in pregnancy. There are some that are not safe in pregnancy. So the ones that are safe in pregnancy, the obstetrician will recommend or continue. And then the ones that are unsafe, the obstetrician will withdraw. So a woman that is pregnant needs to have drugs reviewed by an obstetrician when she's pregnant. Then when it comes to diet, basically the emphasis is on eating healthy, balanced diets. You understand? And not particularly a type of diet. So of course we know the 6 classes of food from primary school, all the carbohydrates, fats, protein, etc. So so the food that a pregnant woman should eat should be rich in all of these things. So you should have lots of proteins, carbohydrates, fats, you understand? So you should basically just eat well. Now, all those herbal things, when it comes to herbal concoctions, agbo, and the rest of them. All those things, they are kind of a little dangerous in pregnancy, you understand. But if it's normal food, eba, rice, yam, all those things, they should eat according to their taste, you understand, as long as it's healthy. Then some of these drinks actually should be taken in carbonated drinks, that's what I mean. Should be taken, if they are taken at all, they should be taken in moderation, you understand, because they contain caffeine. It's not only them. So carbonated drinks, coffee, and tea. By tea, I don't mean this chocolate beverage, not Milo and Bonvita. Like, I mean like tea, top tea, Lipton.
Okay.
So tea, coffee, and then carbonated drinks should be taken a little bit. It should be reduced. They should be taken sparingly. You understand? Of course, they are carbonated, and then they contain caffeine. And caffeine, you know, caffeine affects even us that were adults, affect our sleep cycles. So in utero also affects baby's sleep cycle. So if they are taken, they should be taken minimally, not. So if you want to take drinks, it should just be maybe juiced out of fresh fruits. And then women are particularly encouraged to take lots of fruits and vegetables. Understand?
So what about the exercise part?
Yes, thank you for reminding me. About the exercise, exercise is very good in pregnancy. It is very good in pregnancy. Number one, it reduces obesity in pregnancy. You understand? It makes labor easy. You understand? So pregnancy is very beneficial in pregnancy. Exercise, right?
Yes, you mentioned a couple of things. I just want a clarification on the part about them staying away from alcohol and other such substances. I'd like to know, what's the, what I call it, the resultant effects, because you hear of some women boasting that, I had I was drinking, nothing happened, fine, so is this something that is meant to affect the child or the mother, or what exactly is the danger there?
Oh, the danger is, the danger is both to the mother and then to the child. So, of course, to the mother, most of this substance abuse increases the chances of complications within that pregnancy, which may even include hypertensive disorders of the pregnancy, may encourage diabetes in pregnancy, may encourage bleeding during the pregnancy. You get what I'm saying? Can lead to miscarriages. You understand? Then it can lead to early labor. By early labor, I mean labor when the baby is not yet mature. So those such babies will now need to be in, let's say, incubators for a long time. Then if they survive, they finally make it. Understand? So that's to the mother. Then to the baby, most of those substances can lead to congenital defects. And there's something that is even called fetal alcohol syndrome. You understand? Where the baby comes out, has kidney issues, has liver issues, the body is swollen, the baby appears grossly swollen, a lot of fluid all over the body. And many of those babies did not survive. The babies themselves can come down with IQ. Some of the babies that look maybe grossly normal, physically normal, some studies have shown that they have low IQ compared to their colleagues. So you're having a child that appears normal, and then you're beating the child. It's not doing well in school. Meanwhile, the damage has been done during pregnancy. You understand? And then apart from even the IQ, some of them may have like heart defects. You understand? They may have kidney defects. You understand? So maybe they have the kidneys congenitally dysfunctional. They may have the heart, maybe like heart defects. You understand? That may require even surgery and other interventions, which may still even lead to the death of the child before it even becomes an adult. So it's dangerous to both the mother and the baby.
Right, just about two more questions now. You also mentioned antibiotics that some can affect that, and I think that's another, we like say, what they call local legends about if you find out you are pregnant and you want to get rid of it, pump yourself full of antibiotics. There's a running joke about a particular antibiotic, augmentin, which is said that the price has skyrocketed. So people are saying, make sure you use protection, otherwise augmentin's price has increased. So is there any truth to that?
Well, most of the antibiotics, the effects that they have is not miscarriages per se. They don't usually cause miscarriages. They usually cause congenital defect. For example, tetracycline. Tetracycline usually causes yellowish discoloration of the teeth, and then the teeth, the enamel becomes small. You understand? So the enamel is not sufficient. So a baby will come, and the baby is not that the teeth is dirty. The teeth is just yellow, like really yellow. You understand? So it's discolored, and then the enamel is very small. So that you understand. So effects like that, some antibiotics can cause. Augmentin is very safe in pregnancy anyway, except that some studies have shown that Augmentin, especially in use when the baby is still preterm, might cause has higher chance of causing some irritation to the intestine of the baby after the baby is born. Something that is called necrotizing enterocolitis. You understand? So basically, however, Augmentin may be used in pregnancy. You understand? So some of these antibiotics, what we do as obstetricians is that we kind of balance the benefits against the risks. You understand? Some of those antibiotics, sometimes if somebody is having a very serious infection, and the infection can take the life of the mother, we prefer that, okay, you can balance it and say, okay, you can treat the mother, and then anything that happens in the baby, we can manage that one. You understand? So, but basically, all antibiotics, in fact, all medication should be reviewed by an obstetrician.
All right, so we're pretty much done now. Just one final question to round everything up. I'd like to know, are there dangers to these claims? Someone might feel as though it's just an off-chance comment on social media, thereabouts. But I'm wondering what could be a real-life consequence of some of these claims, unproven, false, or otherwise, spreading online?
Okay. Well, the way I'll go about it is this. In some women, what this might just cause to them is that they may get pregnant thinking that they can use, let's say, Zobo as a way of inducing a miscarriage or inducing an abortion, which of course most likely will fail them. You understand? So it might lead to unwanted pregnancies. And already Nigeria has a high level of maternal mortality, which is death of women while pregnant. You understand? And one of the leading causes of maternal mortality in Nigeria is unsafe abortion. So of course, what causes unsafe abortion is unwanted pregnancies in the first place. So someone thinking that Zobo protects them against pregnancy, so Zobo can flush pregnancy, can cause them to fall into charlatans. You understand? They get on pregnancy unwanted, and then they try to use Zobo. Of course, that will not work, and then they have to go and meet quacks that can damage their reproductive career. So that's on the one hand. On the other hand, well, taking Zobo or not if people decide not to take Zobo, of course that will not affect them. If people say, okay, I heard on Twitter that Zobo is not good in pregnancy, and they don't take Zobo, and they're eating healthy, it will not affect them. Understand? It's like someone saying, it's just that they've taken one food off their menu, but otherwise it won't affect them. But what can be more dangerous is when people advise people to do things in pregnancy. You understand? Because when you do things, then you can have an effect.
All right. Thank you so much, Dr. Bansu, for coming.
Thank you for having me.